The next one is assisting clients with dressing changes. The goals are to know the difference between a clean and a sterile dressing, assist the client with changing a clean dressing, and assist with changing a sterile dressing. What are dressings? Dressings are protective materials placed on the body. Dressings have many purposes that includes protecting an area of the body from further injury, preventing germs from entering a wound, guarding against heat and cold, reducing swelling and bleeding, keeping the skin from drying out and cracking, absorbing drainage, and providing a surface for applying medications. Let's go to stable and unstable surface wounds and clean and sterile dressings. Stable surface wounds are closed, meaning they are crusted or scabbed over, not draining, and not infected. Clean dressings are applied to stable surface wounds. These dressings can be changed by the client, the family, or home caregivers. The unstable surface wounds are open, no crust or scab, may be infected or draining, and it may be red, swollen, or hot to touch. Sterile dressings are applied to unstable surface wounds. The equipment used for these dressings must be sterile. Sterile dressing changes must be done by a nurse, doctor, the client, or the family members, not by a home caregiver. However, the caregiver can assist. Let's go to supplies for assisting with dressing changes. We have the gauze dressing. This is a plain gauze or cotton-filled gauze. It is in a standard size that are 2 by 2, 4 by 4, and 8 by 4 inches. And the purpose of this is to cover wounds or prevent pressure sores, for example, between the toes. We have the Telfa dressing. This is a special gauze with a non-stick surface. The purpose is to cover wounds that are sensitive. The non-stick surface will not stick to wounds when being removed. We have the ABD's abdominal pad. This is a large, heavy gauze dressing. This is to cover small gauze dressings and hold them in place to provide absorbency. Next is a Kerlix bandages or cling. It is a woven gauze that can stretch and mold to a body part and hold in place. The very purpose is placed on a bony area such as knees and elbows. So now let's go to supplies for assisting with dressing changes. First, we have binders. Binders are fitted cloth or elastic fabric for a specific body part, and this is used to hold dressing in place and give support to a surgical wound. Next is an adhesive tape. Tape with a sticky surface that is applied over the dressing and attaches to the skin, and it is used to hold gauze dressings in place. And then we have the Montgomery strips or MS strips, tie tapes. These are fasteners that you can use instead of tape to hold bandages in place. Straps are tied together instead of being taped to the skin. It prevents skin irritation for clients who need frequent dressing changes. Now, your role in assisting with the sterile dressing change. Tasks that you are allowed to do. You are allowed to do the tasks that are only they are on the client's care plan. Assemble necessary equipment and supplies. Make sure wrappers are not torn or wet. Check the expiration date. If there is any question about whether a supply is sterile, do not use it. You can help the client to position themselves. You can cut tape, dispose soiled dressing, store unused supplies properly, observe, record, and report. The tasks that you are allowed to do only under special circumstances. You should do this task only if they appear on the client's care plan and you have been shown how to do them by the supervising nurse while you are in the client's home. Sterilizing equipment and cleaning equipment. Now, let's go to tasks you are not allowed to do. You are not allowed to set up a sterile field. You are not allowed to remove wrappings from new dressings or remove soiled dressings. You are not allowed to apply prescription and or non-prescription medication to a dressing or apply a new dressing. I will have this abbreviation for the timing of dressing changes. Dressings are changed as directed by the client's care plan or by the supervisor nurse. The care plan may order the dressing to be changed at very specific times of the day. The care plan may indicate once a day or QD, twice a day BID, 3 times a day TID, 4 times a day QID, at bedtime HS, and as necessary PRN. If the plan says that the dressing should be changed PRN, the client will tell you when they would like their dressing changed. They will probably want it changed when the surface of the dressing is soiled or loose. Medications need to be applied. It feels uncomfortable. So let's go what to observe, record, and report. You have to record the time of the dressing change, who changed the dressing, and who care given to the wound, or what care given to the wound, special supplies used, the date, signature and title, and any changes observed. Now, what to observe and report? Changes to the skin, color change, a scab that has dislodged, bleeding or swelling. You have to observe and report the odor or if there are drainages. Meeting the client's needs during dressing changes. Encourage the client to do as much as he can. Provide for the client's comfort and warmth. Assure the client's privacy. Use supplies economically, don't waste. Be supportive and encouraging. If you have difficult feelings about assisting with dressing changes, discuss your feelings with the supervising nurse. Now, I will go to this skills checklist of assisting with changing a clean dressing. Explain procedure to a client. Wash hands. Assemble equipment like new dressing, tape, bag for waste. Provide the client with privacy. Assist client to a comfortable position. Provide good lighting. Remove clothing covering the dressing if needed. Place waste bag near client for disposal of dressing or waste products. Put on gloves. Remove wrappings from new dressing. Cut tape. Remove and discard old dressing and used gloves. Wash your hands. Put on new gloves. Clean skin around the wound according to directions on the care plan. Apply new dressing to wound. Tape new dressing in place. And remove and discard waste bag. Remove gloves and wash your hands. Store unused or unopened supplies. Observe, record, and report any changes in condition such as change in how the wound looks or changes in behavior.